Hello, everyone. This is Jeannie Grosso coming to you live from Honolulu, Hawaii, and welcome to the Beyond Breakthrough Show, where our mission is to help others break through barriers and unlock their full potential for an abundant life of health, wealth, and freedom.
That's right. And my name is Sharla Land, coming to you from Phoenix, Arizona. And so today's topic, we're going to talk about the rise in cancer, heart disease, and neuro conditions, which are why it's caused and what causes it and why people aren't recovering and what we can do about it. So, as an RN, Jeannie, I feel like this topic is of utmost importance. And the reason is because we are seeing a rise in increase of strokes, which is under the neurologic conditions, which is also part of a circulatory problem. We're also seeing a rise in heart disease, congestive heart failure, and we're also seeing rises in cancer. We're seeing a rise in, I think, all conditions across the board. And one of the things that I feel is really contributing to that is, well, a couple different things. Number one, toxicity. We are living in a very highly toxic environment. We're exposed to massive amounts of chemicals, which do get into our system through eating, breathing, eating, because and then the other contributing thing I feel is lack of nutrients, or really good nutritional support. We know that our food is nutritionally deficient. We've known this for decades now. They're over-tilling the soil. They're not letting the land rest. They're not nutrifying it the way that they should. So therefore, when our food is nutritionally deficient, then we become nutritionally deficient and we start to see cell breakdown. So if we see our bodies aren't nutritionally fortified and getting enough nutrients, we see that contributing, even doubling or tripling the effects of the toxins in our body, because our bodies just are lacking the ability to get rid of toxins. I don't know, I'm sure, you and I know, but a lot of the audience, you guys may not know this, but a lot of our bodies are able to produce our own detoxifying molecules. We have a molecule in our body that our bodies make naturally to get rid of the toxins, to clean out our cells. So toxicity, it contributes to inflammation. Inflammation contributes to cell breakdown, which then contributes to inflammation and so forth, and leads to disease. So I know that one of the things that I'm seeing as an RN working bedside now, I work in a neurologic unit, and we see upwards sometimes of 10 to 12 strokes a day coming into the emergency room department. So part of how I know that is when an ambulance is on the way to the hospital, they will announce it overhead: stroke alert, ED, ETA, 3 minutes, stroke alert, and they repeat it over. So a stroke patient's coming in to the hospital. So number one, that almost sends chills up my spine as a nurse when I'm working on the floor. I'm like, oh, here comes a future patient coming into the emergency department who will then eventually get transferred to my floor, right? So I often wonder as an RN why we're seeing rises in stroke, rises in heart disease, clot production, neurologic issues. And I, in doing my own little self-studies and my own realizations in my mind when I see this going on, and for the last decade, I know for sure I've been on an anti-aging track, and how do I get to optimal health? I know you've helped me along that path, thank the Lord, for divine connections and partnerships, because that opened my eyes to a whole world of really what's causing issues. So number one, I think we're toxic, and our bodies aren't able to get rid of it. And I'm going to have you kind of segue into that, Jeannie, and what solutions that we have for that. But if I were to Google the incidence of stroke over the last 10 years, we would definitely see a sharp incline. We're not seeing decline in diseases. Matter of fact, people in cancer specifically, we're seeing rises in cancer numbers, not decreases in cancer numbers. So it's part of a whole system-wide problem. Number one, we're in a sick system. Number two, we're toxic. Number three, I think also we live in an over-sterile environment. We're seeing a lot of infectious process going on too. People are actually dying of infection, pneumonia, sepsis, which is infection in the blood, where an infection may originate in a certain area, but then because it went untreated, then it gets toxic into the blood. And then we're using high doses, heavy doses, and very strong antibiotics, IV, to be able to get rid of that infection. And a lot of people don't realize that hygiene is also a big issue. One of the things that our hospital does is mandates that people have oral care twice a shift. And that tells me that a lot of things in our immune system, or a lot of factor goes into hygiene of the oral cavity, because our gut biome is also a big factor in our health as well. So I know I'm kind of jumping around a little bit, but I want to let the audience be aware that we are not decreasing the numbers of disease. And pharmaceutical companies are not seeing numbers of decreasing disease, meaning that their pharmaceuticals, the medications they prescribe, are not making people better. They're making actually, in fact, people sicker, more dependent on the system, and their bodies don't have the ability to heal because already they're toxic from environmental toxins, from toxins that we take in every day when we eat, breathe, and drink, combined with more toxins, medications, everything from Advil and Tylenol over the counter to heart medications, seizure medications. Those all contribute to toxicity in our system, and weighing our liver, our filtering systems down, weighing them down. Our kidneys are suffering, our liver's suffering. And what I found when you called me just about a little over 2 years ago with a solution, I was actually blown away. And I would love, Jeannie, I know you're a medical massage therapist, you're an esthetician, you're a nutrition expert. So if you could tell the audience today about what you shared with me just 2 years ago that made me, as an RN, fall out of my chair, literally. I almost couldn't believe that there really is truly a solution to being able to get rid of the toxins, decrease that incidence of inflammation that does end in disease. So with that, and I know you had a wellness center for in Fort Lauderdale, Florida. So share your expertise with us and your search for health and anti-aging. I'd love to hear and have you tell the audience, what you shared with me.
Thank you, Sharla. First of all, I'm just a little bit more curious on what you're seeing. I know that you went from palliative care and hospice nurse to the neurological unit. So they're still saying that the leading cause of death is heart disease, and then cancer, and then strokes. So are you saying that more people are coming in with strokes than heart attacks now?
Yes, really? I am. Yes, I am.
So what does that mean? Like, are they even younger people in ages?
Mm-hmm. I'd have to say, Jeannie, I've noticed, especially in the younger populations, and I'm saying like age 50 or 60 and below that. So what I'm seeing is younger people are coming in with signs and symptoms of stroke, or actually having stroke. I mentioned, I think in a previous podcast, that we had a 22-year-old young kid. He was an adult, of course, but for me, that's a kid. You're barely starting your life. He had multiple infarcts or multiple strokes on the brain. And when I got to investigating, because we have a series of questions that we have to ask either the patient if they're able, or the family if they're not able to answer the questions, maybe because neurologically they're not alert and oriented ×4. Alert and oriented ×4 means alert and oriented to person, place, time, and situation. So you and I are alert and oriented ×4. But what happens when people come in with stroke, their cognitive functioning a lot of times is affected, or their ability to speak. Maybe they're cognitively okay, but it's affected their one side. Maybe the stroke happened in the right side of the brain, which caused left-sided weakness. So we have to ask every patient and family, what their history is. Number one, their health history. But
Yeah.
number two, have they been exposed to anyone with infectious diseases? And then also if they've ever been vaccinated. Have they been vaccinated for the flu this season? And have they been vaccinated for COVID? And what is the other one that they ask? Flu, COVID, and there's another one, pneumonia vaccination. So usually in the younger population, pneumonia is not really an issue because we're healthy enough to be able to fight those things off. But in the population of 65 and older, we always ask them about pneumonia. But what I'm finding, and it's in particular going back to this kid who is 22 years old, he had 13 infarcts in the brain, which affected his ability to care for him. It made him bedbound, affected his ability to use of the one side of his arm, the ability to care for himself, brush his teeth, comb his hair, being able to bathe. This is a catastrophic event that happened in this young kid's life. And this particular patient, and you can't always attribute it to one thing, but I think in his case, it was attributed to maybe a couple things, but main thing is that he was vaccinated for COVID.
So are all the people that came in for strokes, were they all vaccinated?
I would have to say in my months or my time in the hospital, 95% of those patients have been vaccinated. Yes.
Yeah, and you're speaking of the COVID vaccine specifically, not just the flu vaccine.
Correct.
And so do you notice that people got the flu vaccine and the COVID vaccine, like both?
A lot of times they get double vaccinated. They'll get vaccinated within a few days of each other in the same day if it's not contraindicated by the medical standards, meaning contraindicated, like you're not running a fever, you don't have a cough, you haven't shown any signs of having a cold or flu, then yes, you're clear essentially to have these vaccinations. And many people don't even realize that some medications that are on may be contraindicated to the vaccine. And we know there's 4 or 5 pharmaceutical companies that have put out vaccines. Some have different mechanisms of action. But what I have found with the COVID vaccine, people are very hypercoagulate. They hypercoagulate, meaning that they clot, their blood clots much faster, or it clots much easier than it did prior to the vaccine. So I've seen huge amounts of stroke come in since vaccinated started about 4 years ago, or 3.5 years ago. Yeah. So now for them to be able to pinpoint and track it back to the virus or to the vaccine is going to be, most people aren't going to track it back that far. But we hear that people have long COVID, which is symptoms from COVID. And then we also have people who are suffering from long-term effects of the vaccination. And we've seen people who've been vaccinated that have become paralyzed the very next day, people who passed out or died right after the vaccination. We've seen multiple athletes, soccer athletes in particular, that have been dropping dead on the fields, the soccer fields. This is international. This isn't just something that's happening here locally or just in the US. So one can't help but wonder the correlation between the two. And I know many of the vaccines have graphene oxide, which is a microscopic mesh metal. And that when those things float around in your body wants to attack it. Your body's immune system wants to go at it and take care of it and try to get rid of it out of the system. But the body's been unable to do that. And people are suffering from long-term effects from vaccines. It's also been, oh, go ahead.
Yeah, well, so they might be coming in for the stroke, which is more of the blood clot, opposed to, and then that's when they find they might have the myocarditis. Is that what you're saying? So they're coming in initially for the stroke on an emergency over a heart attack, but then they find out the correlation between the heart as well.
Yeah, sometimes they'll come in and find out that they also have a heart condition, or that they, one of the biggest precursors or risk factors to stroke is atrial fibrillation. And what atrial fibrillation is an electrical conduction problem with the heart, which can lead to inflammation of the cardiac or the heart muscle. But primarily what happens with atrial fibrillation, so you have your two lower chambers, okay, that squeeze and contract, and then you have your upper chambers that squeeze and contract, and they're supposed to work synergistically with each other based on the electrical conduction of the heart. But what's happening is things are interfering, whether that's toxins, inflammation, whatever that is, interfering with that electrical conduction. So the nodes in the heart aren't communicating or talking to each other. So when those upper chambers of the heart are fibrillating, they're not getting a good, solid, nice contraction. They're fibrillating. They're sitting there going like this. So where the bottom chambers are pumping, the top chambers are going like this. So what happens is the blood pools. It can pool in either the left atrium or the right atrium of the heart, the upper chambers. And then that blood clot, once it's formed in the heart, can travel to the body. And it can cause a blood clot in the leg. It can cause blood clots in the lungs, which is a pulmonary embolism. A blood clot in the leg is called a deep vein thrombosis. And sometimes people get clots in the arteries, which is even more dangerous. And then that clot can also travel to the brain, which causes stroke. So clots that travel to the heart is heart attack, okay? There's also plaquing too that can contribute to stroke or heart attack. So, or heart attacks can be caused by the vessel gets clogged up with plaquing from high cholesterol levels, from, we can talk about that here in a minute, but high cholesterol levels, fat intake, sugar intake. Diabetes is also a precursor and a risk factor for diabetes as well. I mean, for stroke as well. So we're looking at the biggest things that contribute to stroke. But one of the factors that we're not considering when we're talking to patients in the hospital is their awareness that maybe vaccinations have contributed to the toxic overload or toxic.
That's what I was just going to ask you, because I wonder how many people are even attributing, making that correlation. And so when someone comes in for a stroke, what percentage of the people are okay after the treatment, or do they die, or how does that work?
So some of the more catastrophic strokes, we see people pass away. I can't tell you specifically the amount, the percentage off the top of my head. But I do know that about 50% of people actually have better outcomes than anticipated when treated early. And of course, my God, don't avoid going, please don't get me wrong. If you have symptoms of a stroke, get in immediately. You got to get emergency care. You got to start, getting in something that might dissolve that clot and reduce the risk.
What do they actually do for it in the medical system?
Yeah. So what they do, say someone's coming in, ETA 3 minutes, stroke alert, that emergency room department is going to be ready to receive them right away. And we have a 90, per the NIH guidelines, National Institute of Health guidelines, and stroke guidelines, we want to get them in and treated within 90 minutes. That means all scans, all blood work, IV started, and then we're also administering IV medications so that we might be able, if they're candidate, be able to dissolve that clot with some kind of alteplase, streptokinase, something like that, that will break up that blood clot. Then they're immediately started on blood thinners because right now they're in a crisis. We have to treat the crisis. But what we want to do, and the purpose of having these podcasts is to be able to help people prevent stroke, okay?
Yes.
And for those, unfortunately, that have had stroke, we want to help them recover better from that stroke.
So let me ask you, is a stroke a 100% preventable?
I'd have to say you could prevent stroke very easily. I don't know if anything's 100%, but if you live a healthy lifestyle, you're keeping hydrated, you're allowing your body to detox, given natural supplements. There are ways to detoxify and help the body be able to not even form clots, okay? And And what we're going to get ready to talk about is going to be a really great solution for against stroke risk, because what you're doing essentially is you're fortifying and nutrifying the cell. But before you do that, you're getting the cell detoxified so that it can operate and function at its very best. And if your cells are operating at 90 to 100% functionality, you're going to avoid not only stroke, but you're going to avoid a lot of other diseases and conditions. So I would have to say to close to 100%, you know, you may be able, I mean, there's other factors.
Yeah, there's probably nothing 100%, you know, but
yes. Because
you know, because there's an accident or an injury situation too, where I suppose you can have a stroke.
Yeah.
Right.
Yeah.
But
absolutely. Absolutely.
Okay. So basically we've learned, and even VAERS, if people, I remember 5 years ago, I had learned, or longer than that, I learned about VAERS, VAERS, and that is the vaccine, the injury line by the government. And I used to, before I got blocked off of social media for posting about that, I basically was posting the increase from the time COVID started, the time the vaccine started in 2019, I think it was December at the end of that year. As soon as the vaccine was launched, the numbers of strokes, of myocarditis, or heart conditions, and Guillain-Barré disease and other things, but people were being, and death, of course, the numbers kept rising by like the thousands and hundreds of thousands. I stopped tracking it years ago because enough is enough. So just, it's interesting to hear from you, who is actually physically working aftermath in the hospitals, where you're still seeing this rise. It's never gotten under control, and people aren't even attributing it to all the boosters and all the shots and all the stuff. So here's the bottom line solution to end up this, and we didn't end up talking really much about cancer or heart disease on this one, so maybe we'll talk about that on the next one. And basically all disease is what Sharla said. It all starts out with a toxic exposure that turns into an oxidative stress, which means oxidation, which is like rust on the cells. Okay, and then it leads to inflammation, aka 78 classes of disease. All bacteria and viral infections are all because of toxicity and oxidative stress, period. People are dying instantly from those. Now, nutritional deficiencies plays a role, but that doesn't necessarily cause instant death. That is premature death. So those three factors are the three factors that, if anyone gets anything from this entire podcast, in every podcast that we do, there's three main factors. And you can add in mold and other toxicity in the toxic category, because there's parasites too. And that is also a contributing factor. But people don't die instantly from mold and parasites. They have this long, slow, undiagnosed, oh, it's lupus, oh, it's, Lyme's disease, it's this, that, and the next thing, it's a genetic condition. Well, it's mold, it's parasites. That plays a huge role. But initially, if you can just grasp that every single health problem you have and every single condition that you can't recover from, you can pray and pray and pray, but you need to do what's possible. And a healthy cell is the only way you can do it. So with that being said, there's only one molecule. It's called the master molecule. It's called the master antioxidant. It's called the premier peptide. It's an amino acid. It's a tripeptide. It basically is the holy grail. It's the only thing that you can help people recover. It's called glutathione. Yes. And even Dr. Oz says, write it down because it's critically important. And who's talking about it? Nobody. Even the doctors aren't talking about it because they don't know anything about it. And guess what? You can go into a naturopath that administers, or an integrative doctor that administers IV glutathione, IV vitamins and minerals, IV this, IV that. They don't even know what glutathione is. That's why we're doing this podcast. This is way out of our comfort zone. You and I have never done this before, but we are on a mission to help educate people because education is empowering. And this is
Yes.
saving people's lives single-handedly. This technology, the biggest breakthrough technology in human health history and skincare, because the skin is our first line of defense. Our
Yes.
skin is a detoxifying organ. Our liver is the primary detoxifying organ, but our skin is the largest organ in our body, and it's our first line of defense. And we have glutathione from the inside out and the outside in. That's the miracle. We have the delivery system that has solved the long-standing issue of instant cellular utilization. There's a lot of products that are bioavailable, a lot of products that get absorbed into the blood, but do they get into the cells? Ask your doctor that. The answer is no, because we have, at this point in time, September 18th, 2024, there's not another technology in the entire world at this moment that has taken glutathione, nanosized, meaning reduced the particle size of a glutathione molecule under 10 nanometers. That part has never been done in history, and they encapsulated into a ultra purified water molecule. The process of cleaning the water and purifying the water is another breakthrough technology standing alone. And then we were able to purify this water 400 times more pure than the hospital IV solutions. So hospitals don't even have this unless they have our technology. And that's why it's such a big deal, because this technology is completely protecting the nano-sized glutathione molecule. And it's not just glutathione, it's L-cysteine, which is part of the glutathione molecule. And that helps your body continue to produce more glutathione. And the other part of the formula is curcumin and vitamin C, which is another major antioxidant. So that formula are patented or patent pending. All of our formulas, you will never find anything that can even come close, or it'll be infringing on our patent. And our technology is proprietary, so nobody in the world will ever be able to figure out exactly how we did it. We're the first people to the market. We've been on the market for 3 years and now in 74 countries. Okay, we have an entire this product that you take by swishing in your mouth like mouthwash. Is so simple. You just swish it in your mouth. It goes through the mucous membranes, in and out of the blood, across the blood-brain barrier, into the cells, 70 to 90 seconds intact. And then you spray it on your skin. You just mist it on anywhere in your skin, and it goes through every layer of the skin. There's not a skincare product in the world that can do that. Okay, so even if people are experiencing pneumonia or bronchitis or sore throats or strep throat, I bet that's on the rise too. Mono, all these autoimmune diseases, you can not only gargle it, you can spray it up your nose, spray it in your eyes, spray it in your ears, let it absorb. It's all water. So it's easily absorbed through the skin, and it's nano-sized, and it's glutathione, which is the miracle molecule that can do everything. So the main thing that we have 3 main factors that are causing the stroke, the heart attack, and the cancers, and all the other 78 classes of disease: toxicity, oxidative stress, and nutrient deficiencies. And guess what? Glutathione, the tripeptide, 333, okay, it combats toxicity, oxidative stress, and nutrient deficiencies. It does all the same 3 things that combat every health issue. So if people want to prevent, all they have to do is swish and spray every day, multiple times a day, depending on your health condition, depending on your age, and depending on your body weight. People, if you don't feel or see anything, you're not taking enough. It's that simple. And you can administer it without a doctor. You can administer it to kids. You can administer it to old people that can't. You can even administer it to your pets. You put it in a syringe, you put it in a spray bottle, spray their gums, spray their skin. It goes through and you get it done. And you know what? The more people that we can get this message to, the more lives we can save. It's that simple.
Absolutely. I mean, Jeannie, you said it all right there. We have the solution to the 3 main causes of disease: toxicity, nutritional deficiencies, stress. I mean, we are on top of this wave And the healthcare industry is trillions of dollars. We have the technology that will dwarf anything out there on the market. And what I've really, I mean, you said it. I've been able to stop a virus right in its tracks. I feel something coming on. I just
Yeah.
swish it. I swish it every couple hours. I mean, even Steve Scott has said, I started off having this symptom. I started swishing. By the next morning, I was good to go. And
imagine what it would do for the pneumonia, for the people
Yeah.
that have breathing issues, the people that already have asthma and allergies. Imagine that. Imagine before they even have an allergy or an asthma attack, if they just did enough of this glutathione. We don't have the miracle product. We have the miracle technology to take the miracle ingredients and get it into the cells. That's all we do, is the delivery system. And nobody can compete with that. There's no other form on the market. And that's why we invite people to these presentations, because, like, what is there to think about? I mean, we have it. You can, everything that we're saying can be backed up. You can just Google, you go to Google and say, Google, what are the top 10 benefits of glutathione?
Well, we have 19 voluntary medical advisory board members that volunteer their time to contribute their expertise to this. I mean, this is an amazing, this is a technology.
If I had a doctor, they would be the only kind of doctor I would go to. The first question I would ask is, do you have glutathione?
Yes.
You don't need to ask your doctor, like, oh, have you ever heard of glutathione? You don't need to say that. Do you have nanoglutathione is your question. You don't introduce them to us, and we'll get them, you know, their special professional reseller program so they can administer it to their patients and clients. We have hospitals, we have care homes, we have doctors' offices, we have medi-spas, we have health food stores, we have franchises, we have fitness centers, we have rehab centers. I mean, we even have pet care,
nutrition, vitamin stores. Yeah, I mean,
vitamin shops. I mean, like, you know, it just is killing me to watch people needlessly suffer, and watching their family members suffer when we have a solution. And go look up all the benefits of glutathione. There's 400 functions, 15 are critical for life, but we already talked about the top 3. But what are you talking about? You're talking about instant cognition. You're talking about energy, performance, recovery. You're talking about immune system boosts. You're talking about reducing inflammation, reducing joint inflammation, reducing having better sleep. I mean, basically, one molecule does it all.
Yeah.
And then what you don't see is, you don't see the cells detoxifying. You don't feel that. But overall, when you get your blood work done, you're going to start to see your cholesterol levels, your sugar levels, everything is going to balance out, your hormone levels, your thyroid levels. And you know that, and that you can't test accurately for your glutathione levels, but you don't need to. Just go get your blood panel, go get a heavy metal test, go see how much heavy metals you have. And then test again after 3 months, after 4 months, after 6 months, years. We've been on it for 2.5 years. We're anti-aging. We are like, I mean, I will never get a facelift. I never was going to get
I think I actually, I have to say, we look, and we're tooting our own horn here, but really, honestly, Jeannie, you look way younger than you did 5 years ago, 10 years ago. I mean, your skin has improved tremendously from the time that I met you to now. I mean, and you were an esthetician. You were using the very best products on the market
that I could
on
find.
Your skin.
Yeah. And not only that, I was getting cosmetic procedures too, and doing peels and doing masks and doing all, you know, with equipment and facials and stuff. So I'm no stranger to getting cosmetic work done to maintain that. You know, I've had full lasers on my face. Okay. I've had laser face stuff, and it's like painful, extremely costly. And this is like an unbelievable, I mean, anti-aging skincare regeneration. I mean, it's just, we can't even, hormone balancing, better sleep, better energy, reducing stress. I mean, there's nothing that this technology bringing the critical ingredients can't do. And that's why I'm really excited to talk about what nobody wants to seem to talk about, is the diseases, the COVID, all this stuff that we're affected by, the medication, all that stuff lowers your glutathione levels anyway. So you automatically need it. No matter what you believe, you still need glutathione. And
Yes.
and you can take all the vitamins in the world that you want, and you might have the best delivery system, liquid vitamins or IV vitamins and minerals and all this stuff. You think you doing all the best things for your body, but you've got it's still an issue. You need to detoxify first. And glutathione is the primary detoxifier and chelator of heavy metals.
You can't even absorb nutrients when your cells are toxic.
You can't.
So then
And
you're trying
an
to
obese person, why even bother taking vitamins?
And half your,
you know?
Only 10 to 15% get absorbed anyway through the gut. So you really, you're really defeating yourself. People are spending it anyway. And I have to say, I used to take a ton of, we were nutraceuticals, okay? But I was able to reduce the amount of nutraceuticals I take because I have glutathione on board now. It tells the nutrients where to go. Yeah,
we're redirecting, and I've redirected my entire skincare budget. I would spend over $100 a bottle for a serum and a night cream, or something like that. And this whole system, 2 products is $100. Where can you go and get inside and out and outside and in? Now I've used a few systems a month. It's not meant to be a month supply. I guess if you only use it twice a day, but depending on your age and health and whatever you're trying to achieve, I go through much more because I know the value of glutathione. There would be no oxygen-based life on Earth without glutathione. You die without glutathione just as fast as you die without oxygen in 3 minutes. So, anyone we've ever talked to doesn't say no. You'd have to be literally brain dead to say no to glutathione. You're not saying no to us. We don't take it personally. But once you learn what glutathione is, you won't go a day without it.
That's right.
And so, thank you for joining us on today's episode. We will see you same time same time, same place next time.
Next podcast.
Thank you so much.
Yes, thank you, everyone.
Have a great day.